On the day the 1 millionth vaccine is administered in Ontario, the Ford government promises 1 million more will be jabbed into arms in the next 3 weeks. And now pharmacies and family doctors will start immunizing people as well.
There are going to be vaccines enough for all of us, and they're going to be here very soon.
Not only is the Ford government promising a combined 2 million vaccinations will be administered by the end of this month, it also promises everyone who wants one will have one by June 20th.
We're talking 3 months here to be able to get the vaccination rollout complete for the first needles.
To do that, starting today, roughly 122,000 vaccines would have to be administered every day. So far, the highest daily number of vaccines given out has been about 40,000. But the Premier promises they can more than triple that by the end of this month.
We will have more than 120 new mass immunization clinics open by the end of the month, giving us the capacity to deliver up to 150,000 doses a day.
In addition to mass clinics, as of Friday, 327 pharmacies in Toronto, Windsor and Kingston will be immunizing people aged 60 to 64, or those born between 1957 and 61. They'll get the AstraZeneca vaccine. You can already sign up on pharmacy wait lists. Each one will receive 40 doses a day. And don't try to overbook at multiple pharmacies.
Once you book an appointment, you will not be able to book a second.
And as of Saturday, doctors in Hamilton, Toronto, Guelph, Peterborough, Simcoe, Muskoka and Peel will receive 29,000 vaccines and call patients from 60 to 64 that qualify. The provincial online booking system will be operational this Monday, but the opposition is warning it will be like the Wild West.
It's a system that's just way too chaotic.
There's going to be all these different points of access. And then the next challenge becomes, is that fair? Is that fair to people who don't have good internet access? Is that fair to people who have a language barrier?
Concerns have been raised by the opposition and some doctors that there aren't any safeguards to stop queue jumping. For example, when Phase 2 begins in April, no proof is required for those with underlying health conditions. In theory, someone with asthma could get a dose before someone who just had a transplant. Doug Ford dismissed that concern today.
The difference between the Leader of the Opposition and ourselves, we actually have faith in the people of Ontario. The people of Ontario got us.
The Premier is asking people to only go on the provincial booking system when it launches on March 15th if they meet the 80-plus age qualification. He doesn't want it to crash. If it does, though, he says don't panic. They will get it back up quickly. And for the first time, I got a sense of some relief at Queen's Park today that the light at the end of the tunnel is getting closer and brighter. Ontario just has to outrace and out-vaccinate a potential third wave.